Good afternoon and welcome to Beyond Email and SharePoint Strategies for Increasing Employee Communication and Engagement, a Health System CIO Media Inc. production sponsored by MangoApps. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your audience, to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take those later in the program. Just so you see how we're going to spend our time today, first we're going to spend about 35 minutes with our panel discussion featuring Jonathan Hensley, Director of User Experience with TeamHealth, and Vishwa Malhotra, co-founder and CTO at MangoApps. And then we will have our audience Q&A. So without any further delay, let's jump right in to our discussion. Jonathan, let's start with you. Can you give us an overview of your organization and your role?
Sure. Thanks for having me today, Anthony. So TeamHealth is a clinician staffing and healthcare services company that helps hospitals run more efficiently, essentially. As you said, I'm the director of user experience, and basically our team's job is to lead, guide, and direct the design of and improve user experience in everything that we put out as a company to our users, whether they be clinicians, administrative associates, executive leaders, or client partners, or even patients.
Even patients. So it even extends out there. Tell me a little bit more about that.
Anything. Yep. Yeah. Anything user facing. So we have most of our businesses B2B, but working with client hospitals and facilities. But we do have some direct to consumer, direct to patient offerings. So lots of web stuff, lots of some app stuff internally, everything across the board, user facing.
All right, very good. Vishwa, can you tell us a little bit about your organization and your role?
Sure thing, Anthony. So MangoApps is in the business of helping organizations modernize their employee experience with its widely recognized employee communications and engagement platform. And we've been doing this for over 15 years now. And in the last decade or so, we have also been a trusted healthcare digital partner to over 35 healthcare organizations in the US. We earned our high trust certification as part of our commitment to serving the healthcare industry with one of the best employee experience solutions that exist in the market today. My name is Vishwa Malhotra, and I'm the co-founder and CTO at MangoApps. So that's a little bit about the company and me.
Very good. I'm sure we'll get more into security, but you mentioned getting high trust. I interview a lot of CISOs. Some of them find that to be a quite important thing that they're looking for as they try and make sure that any companies and any apps they bring on board are secure. Can you tell me a little bit more about the decision to go for that high trust certification and what kind of a bar it was to get over? I know they have tiers now, which makes it a little less intimidating to some companies, but your thoughts there?
Yeah, it was a conscious choice and a decision as we started to sign up customers. It made us realize the importance of going through that certification process if we wanted to commit to serve the healthcare set of organizations. It took us a while to get there. I can't say it was an easy ride. We actually attempted it twice. The first time was many years back. And then I think the high trust certification changed some of the procedures and policies, and then we had to reset ourselves. So it was a long drawn ordeal, but in our second attempt, a couple of years back, we did finally get through it. And today we are high trust certified by a third party assessor. So it's an important thing. We continue to plan to invest and keep that.
Very good. Okay, Jonathan, first question to you. The title of this webinar describes going beyond email and SharePoint. Talk about the limitations of those mediums for employee communication and collaboration. Why is there a need or desire for something better?
Yeah, so I'm assuming you're not just referring to the dreaded reply all situation from email,
Okay,
but
so that's
you know
one of the issues.
that's a big
Okay.
one. That yeah, that's one of them, and nobody knows how to get out of that thing apparently, right?
Uh-huh.
Just always happens, but no matter how hard you try, you're still in that thread. But yeah, so being a user experience focused role, right? One of the things that that email lacks that I think these newer platforms provide are more ability for the user to see, interact with the things that they care about, and not the things that other people are just shouting at you or sending your way. Whether that be the ability to leave specific channels or types of content in a social type platform, only interacting with or commenting or getting notifications on things that you care about. So giving the individual users the control they want to also consume that content in whatever platform they want, whatever cadence they want, in a more asynchronous way, maybe. And then I guess the next obvious thing is the collaboration that can happen in a more robust platform than email, like file sharing, versioning of files, co-editing of documents, and those things are really huge productivity boosters, as opposed to forwarding around attachments. Now there's 30 different copies of the same file with different versions that you got to try to collate eventually. And then things for like our administrative and communications people, there's more efficiency to be had in a more modern platform. You can, once you hit publish on an article or something, you still have the ability to edit the typos or fix the links that were broken, whereas an email you're kind of stuck with doing a reply all to fix those things. So some of that's a little more helpful, and then you get better metrics too that maybe aren't as available for how many people read this thing. Kind of hard to do with modern email.
So in terms of moving forward with a new app, I believe you're with MangoApps, but as far as moving forward, was this a situation where you said we have a problem here, and this is not, our collaboration through email is not working as well as we need it to? So did it start with that, or did it start with a solution coming into your worldview and saying that looks like something we need? Which was first there?
Yeah, we were definitely solving a problem for us. So and it kind of comes down to security a little bit, which I think we'll get into a little bit later. But when most of our clinicians, team health clinicians, are working for partner facilities, not a team health facility in a hospital with hundreds of other folks at their company. So they go to work day after day to a different brand, a different company, and they have email there too that they need to receive for their daily jobs and alerts and things that just go on every day in a hospital. And it's challenging to have two secure email deliveries on a single device because of things like mobile device management. You can only really have one of those, and as healthcare companies, we all want to be able to control our email and pull those things off as people leave, or if they lose their phone. You got to be able to get that stuff back. So being able to manage that content is important, but then they can't get the hospital's email and our email on the same device because of those security limitations. So being that our clinicians are working at the hospital day after day after day, that's the more important day-to-day, hour-to-hour email that they need to consume. So we were getting left out in the cold on email, and needed another path to our staff for them to be able to get their stuff reliably from us.
So yeah, so that's a sort of an interesting paradigm that you have as your organization. If you put yourself into the seat of, let's say, a CIO at a health system, where they're running the hospitals. It's their hospitals, but you have a lot of physicians that come in that are not employees, right? So do you see
Yep.
parallels? Do you see how a new way forward might be useful to them as well, in addition to your unique situation?
Yeah, I mean, they could adopt a modern platform as well and still get around those. The doctors, from what I've seen, are very reluctant to put MDM on their personal devices anyway. They like privacy. They don't want to allow the company to have, I mean, you're basically giving a company access to wipe your entire phone, right? They've got full carte blanche over your device. They can enforce pins and Face IDs and logins and all those things onto your personal phone that you feel like is yours, that you're paying for, that you don't want to allow that type of access. So moving to a non-email platform or something more modern that's app-based, where you can wrap that security inside the app itself, kind of allows you a little more flexibility. So our users can install on their own our app from the App Store. We only have access to the app. We can wipe everything in the app. We can't remove it from your phone, but we can log you out and clear the cache, and you're not there anymore. You can't get back in. So we still have the same level of security, but in an app-based security model instead of a device-based security model.
All right, very good. Vishwa, you obviously, you conceived the company around, and that was 14 years ago. That was 14 years ago. So you had this idea that there were limitations of email communication for employees. That was a long time ago, and I'm assuming you think it's been borne out and proven. Perhaps things have even, in terms of the need out there, the evolution of communications, the evolution of how email has gone, I assume has made your product even more attractive. Would you say that the world has moved towards you as a company rather than away from you?
That's very true, Anthony. And sort of, if I just want to take a moment and step back at a macro level, we looked at some of the statistics out there some time back, and there are about 21 million people in the US healthcare industry today. And out of those 21 million people, as per the US Bureau of Labor Statistics, about 17 million are frontline employees in these healthcare industries. And these frontline employees are anybody who's customer facing, anybody who is patient facing, or anybody who's doing frontline task workers, as we call them. That's about 76% of the healthcare workforce is frontline. And for the large part of the 76% of healthcare workforce, they do not have corporate email addresses. Now, that's for us was the first limitation of email. Frontline employees, for the majority cases, do not have an email address or do not have a corporate email address. And at MangoApps, we called it as a limitation of reach when it comes to email as the channel. Now, many of our customers, and I know TeamHealth is a very unique one and an important one to understand and address. But in addition to that, there are many healthcare organizations who echo in the same sentiment that they have a very small segment of an employee base whom they can actually reach over email. And that brings a need, a desire to connect with these employees in other manner. And that's how MangoApps comes into the picture. Many of the ones who even have a corporate email addresses who are working in clinical settings do not have the time to sit down and sort through their emails. CIOs of these organizations constantly tell us that they want to reduce the risk of phishing emails, and they sometimes even want to drive down the high cost of licenses that come with email accounts. So those are some of the reasons why this desire to go beyond email. I'll take one more example and then pause for a minute. The internal communication teams at many of these organizations tell us that even if they are able to send emails through distribution lists, they get minimal data on how the employees engage with the information that's provided in the email. And then they start to depend on IT and other integrations with business intelligence tools, assuming they have the time and resources to do it, to be able to get insights into the communication that's been sent over email. So that's another reason why there's a desire for something better than email.
Yeah, it's very interesting that there are certain types of people that can easily be overwhelmed by email. I think clinicians may be one of those groups. They're just they're not used to that. Their mindset is not. For me, my whole world is built around email in a sense, and I am like it's part of my life. But for certain clinicians, that's not the way they operate. That's not the way they're set up, and they can easily be overloaded by sort of the volume and the noise and things like that. So it's quite interesting. Um, let's talk about security. Jonathan, uh, it's a big issue here. Big part of probably of everything you do. It's a big issue. But tell me your thoughts around security and as you move forward here.
Yeah, security is a big deal. We've been on MangoApps for almost 6 years now. So back then, it was definitely a bigger deal than it is now that they're high trust certified. But we can't even, when we were surveying the field, you can't even evaluate many of the players out there, especially back then, just from a security standpoint. You couldn't even, most of the options are off the table. So this is a prerequisite that has to be filled for this type of platform. And yeah, it's a huge concern. We're always talking to InfoSec about everything to get approvals for all of our change that happens, app updates and all those types of things. But always checking those boxes. But yeah, security is primary concern. I spoke a little bit earlier about with MDM, mobile device management type stuff, but the app-based model has been a godsend for us, and I think would be in a much harder boat if we were having to convince people to install those security apps on top of. It's just a hard, like every app that we try to get a clinician to install, the more and more there are, the harder it is. So having it all kind of in one place for them to go, consume their communications and get to their apps and do all their things is definitely easier.
So you, from the timing of what I understand it, you went with MangoApps before they were high trust certified. Is that correct?
Correct. Yep.
So, I mean, that's changed a lot over the last 2 or 3 years. Third-party application reviews from a security point of view. So is high trust stakes to play now, or is that too high a bar and you would have too few to choose from? I know a lot of people are putting a lot of work into not only reviewing new application requests from a security point of view, but a lot of people are reviewing their existing application catalog, trying to bring those existing solutions up to standard or make sure they're meeting the new bar. Some people are not. Some people are just focusing on new apps. But your thoughts there, and maybe your thoughts around high trust certification. Again, is it a requirement for anybody you look at, or is that too high a bar?
It's still, I'm not an InfoSec, so disclaimer here, but I do interact with them a lot. I think high trust is the exception, not the rule currently. I think everything's trending that direction. I don't think you're there yet to be able to say we're only going to operate with companies that are high trust certified quite yet. I think the more we look at new stuff, the more important it is. But we definitely are on. We're going to be have partners that aren't yet there. Obviously, it's a big gold star if you are evaluating platforms and people are high trust certified, then that maybe bubbles you up the list of things that people are going to evaluate. So it is important. I don't think that it's not the minimum bar currently.
Are you,
from what I've seen.
have you evolved over the last few years to get security involved earlier in the process of reviewing potential applications?
I think the answer is yes. I'm not sure how much I'm involved in all of that, but the processes have definitely gotten more and more stringent from a security standpoint and change management standpoint. There's a lot more reviews that go on. There's, I think we partner with some third-party security evaluation firms and scoring systems, and all our vendors are kind of held. We're actively following up with vendors who are falling down the list of scoring on InfoSec stuff. So it's definitely top of mind every week, week in, week out.
So
more so than a few years ago.
very good, very good. So Vishwa, we talked a little bit about this, going for the high trust certification, quite a high bar. It sounds like really puts you in an elite company from a security point of view. And that's what Jonathan's saying. There's going to be a few companies that have gone through this, and boy, does that show a commitment to the space, and a willingness that you're going to be around. You're not just trying to dip your toe into healthcare. You're in healthcare. Otherwise, you wouldn't put all that effort into it. What are you hearing from potential customers from a security point of view? Has it changed in your perception? Is it now, boom, right off the bat, part of what they want to talk about? Did it used to be later in the process that, oh yeah, what about this? How has it changed over the last few years?
Well, I think it's quite upfront in the process. So when we are filling up RFPs or RFIs, it's an important component. There are clear minimum criteria in some of these RFPs that ask about certification, whether it is high trust. I think at a minimum, we are still looking at HIPAA compliance when we're talking at healthcare in these RFPs. So I think it's more upfront. And it's marked as required. So at least the ones that we are dealing with, I think we do stand, like Jonathan said, we do move up the list in terms of as they shortlist, and we check mark a big important area for them. And it's not something that you can just say that, security and compliance is important, but you have gone through the process to provide evidence, and there's a third-party certification to it. So there is a lot of breadth and depth in the security and compliance area, and it's not just a white paper that we put out, but we put out the entire policy, process, procedure that builds confidence and trust in that space. Especially as a cloud-based service provider, where you're not deploying your solution on premise, it even has greater significance to have these certifications. And it's an important part of qualifying, especially if it comes to larger organizations and larger enterprises.
Absolutely. All right. Very good. Jonathan, let's talk about rolling this type of thing out. How much is technology, the implementation, and that would be sort of the CIO's role to make sure it works from a technical or CTO's role perspective, and then just the proper way to roll these things out. How much of a culture change is it for folks to sort of get their arms around? What is your best advice there?
Yeah, it's definitely a different world, especially the larger of an organization you are, I think, and the more you've been ingrained in email. As things get more social seeming on the business side. From a technical standpoint, I don't know that there was, it was pretty easy for us. I think coming from an environment where we didn't already have a platform like this, that we were converting from one to another, so it was all new. Maybe that was a little more helpful for us, not having to try to make all the changes at once, but we kind of, I don't know if slow rolled is not quite the right term, but we took our time and were very intentional about how we rolled out, both from a technical and feature standpoint, but also from a deployment or standpoint to users, going basically department by department or group by group, slowly getting people on the platform and then enhancing that platform over time, or unlocking new features just so we didn't have to try to eat that whole elephant at one time. So I don't know if that really answers your question, but
No, that's good. Vishwa, with rollout, I mean, obviously the success of a company like yours doesn't just depend on the sale, right? It depends on the success of the customer post sale. People have to be using it. They have to be using a lot of it. That's what we talk about a lot is you want to know that they're, they didn't just buy it. They're not just using one or two things. They're really, because that means they're going to be happier with it. They feel like their value for the money they're spending. So, what are your thoughts around rollout? You provide guidance around rollout, best practices, anything that comes to top of mind that you want to share here about for anyone, let's say, rolling out a solution like this, or what is your best advice to be successful?
That's a great question, Anthony. And I think what you said that, it's not just about the launch or initial rollout, but it is the ongoing success and adoption of the platform that actually decides how successful you are in the space. And I think one of the things at the foundation of that is being able to help our customers map the employee communication, employee engagement, and collaboration initiative to something very tangible inside their organization, a tangible priority, a tangible outcome, as opposed to trying and creating something new. I'll take an example here. So in one of the organizations, if the top line, business outcome or business priority they had was to improve their customer experience, as they called it, or improve patient experience. And so as part of our, once they've bought the product, you've launched it, you want to make sure they are successful at this top line objective. So one of the ways we went about doing that was asking them some of these questions as part of our onboarding process, which is like questions like, are your critical company updates that are sent to your customer or patient-facing teams through email getting passed over? Are they being read? Are these customer or patient-facing teams out of sync, or do they feel they are not fully informed? Or how much time these customer and patient-facing teams are wasting looking for resources and information that's lost and buried in email? Or how many systems these people having to go through to be able to find this information, the level of frustration they have. So as we go through this questionnaire as part of our onboarding launch process, we find the pain points. And as part of that, we start to map the best practices in employee communication, employee collaboration, and employee engagement to their outcome. And so in this example, if the outcome was improving customer and patient experience, we went about mapping and showing how the customer and patient care teams can get faster access to the most up-to-date information that's trustworthy without they just passing it off, and how it can save time so that they can focus on doing their primary job, which is to provide better customer and patient experience. And then we were able to map how the communication teams, the ones who are creating this content, no longer need to depend on technical resources to make an engaging piece of collateral on day to day, week on week, and be able to target the customer facing and patient care teams, reducing their operational IT cost on one side, but making sure they got the engagement on the communication that was being targeted to the customer facing and patient care teams. So that's how we work, I would say, in making sure they are successful. And we do get good adoption rates, good engagement rates around these communications if we follow the practice of mapping the communication to some organization priority.
Very good. Jonathan, how have you determined if the app has benefited your organization? You mentioned that there's limited feedback from email. I guess if somebody opens it or not, or there may be some other metrics you can get if you're communicating by email and you're trying to gauge your level of engagement. I would imagine with something like MangoApps, there's a lot more data you can get to show engagement, but you weren't coming from a different platform to MangoApps. You were coming from sort of email to MangoApps. But how have you best determined the effectiveness? And then I guess over time, once you get metrics, you can from MangoApps, you're seeing if those metrics improve. But your thoughts there around figuring out, is this working?
Yeah. It's important for sure, and it's there's a lot of data. There's a lot more data from I think this modern platform from MangoApps platform for sure. Yeah, I think I probably back when we converted, we only I think we were on a third-party platform that does email, kind of email as a service stuff where you can get open rates and click-throughs, but those are only for like the most important corporate communication type things. So you maybe had some data on the highest priority stuff, whether people are opening it or not. Whereas in this new model, you have metrics on basically anything that's in the platform: how many people have seen it, how many people have reacted, how many people have commented. You can survey that whole landscape to see what types of content perform better and in what groups and what types of users are actually looking at stuff with much more granularity, I think. But and kind of something Vishwa was mentioning a minute ago about being intentional about how you plan communication is important, and I think it's also different outside of email. The way you create content is different. The way people consume content is different in these more modern platforms. It's people's time is super valuable, especially clinician time, leader time. The faster you can process these things, the faster you can consume them, the more engagement you're going to have, the less people are going to tune you out. So there's definitely a strategy component. None of this is just let's pick the best platform and it's just gonna be, no problems. Everything's going to be great and people are going to love it and they're going to be asking for more. There's still work to do here, but having a platform that gives you those insights is definitely important as well. And teams that work with you to help plan and strategize around how you communicate to your users. We've actually been on the platform so long that we're going back through this assessment with the team currently to, how can we get better? Have things change? Should our strategy change? What are you seeing best practices from other companies that have onboarded more recently? Are our metrics, standing up to what new people are getting, or do we need to adapt and change? So we're going back through kind of that process with them right now. You gotta always keep the foot on the gas with this stuff. You can't let it fall to the background and just think it's going to take care of itself. But you have more tools at hand to be able to assess whether what you're doing is working or not, I think.
And this is related, Jonathan, to very high level stuff, right? I mean, this is probably, there's messaging here from the CEO on down. And this has to do with employee retention. This has to do with burnout, employee satisfaction, and keeping people. And clinicians and all people in healthcare are at a premium. They have more options. They don't have the same level of remote work ability, certainly for obvious reasons. But there is probably more than there used to be for different types of jobs. But this is very high level stuff. This is addresses things that are probably very, very high level strategic priorities for the organization. Is that correct?
For sure. Yep. Yeah, from day one. We actually spent over a year, maybe over 2 years, surveying the landscape to find the right product that was going to solve all of our needs, and it was a priority from the top down, at the very highest levels of the company, and we had to make sure we got it right. So it's huge, and retention is definitely one of those line items that was on the list of things that we were trying to improve, and part of the cost benefit analysis of a new platform was employee retention. It is super expensive to replace a clinician.
And you could tie, it's interesting, you can directly tie retention to these issues. Like this could be the issues this solves and deals with could be so irritating to someone that they could say, I don't never know what's going on around here. I'm getting 50 emails, I'm missing stuff. Then people are yelling at me, so to speak, about you didn't do this or you didn't do that. And I just don't want to deal with it. Like you could literally get to that point, you think, of dissatisfaction that it's a contributing factor in losing people, correct?
Yep, for sure. And I think the analysis back then was that if we can save less than 1% or retain less than 1% more clinicians, then we've more than paid for the platform cost. So it's a crazy ROI when you talk about retention.
That's some nice Vishwa, that's some nice words. It's got crazy ROI. So you must like to hear that. That's what you want, right? You want to be delivering something with crazy ROI.
Absolutely. I mean, we only win if, TeamHealth wins and customers like TeamHealth win. So absolutely.
Yeah. Very good. All right, let's put out our little poll here. So if everybody on the line wants to answer that, sort of a fun little poll, see if you agree or disagree. Excessive volume, spam, and phishing have made email a less than effective medium for engaging with employees. So if you agree with that statement, then let us know. If you disagree, let us know. And we'll address that and give you a minute to answer that, and then we'll get to that. Here's a good one, Jonathan. Who are the key individuals in the key roles that must work together? Even with selection, you mentioned a 2-year selection. You probably want to have the right people involved. Usually you want to have the people that are ultimately going to be using this stuff, the leaders of those constituencies involved in a selection process. So you've got I don't know if it's the same thing, but pre-selection and then rollout. Your thoughts about the key individuals that someone like yourself has had to work with to make this a success?
Yep. As you can imagine, a project like this that was coming from the top of the organization to begin with to solve problems that we had, there was a high degree of interest across the organization at the highest levels. We definitely had, from the beginning, formed a governance team of those top people. So we had people from the administrative employee side. We had people from the clinician leader side, the CIO, the VP of communications, internal communications, marketing people all were involved, and several more IT people to make it all work, or to at least evaluate the field of things. And then obviously there's integrations and things that have to happen to get data into the platform so that you're driving the groups and things you create, profiles, etc., so people can find each other and collaborate. But yeah, I mean, it's all across the board. The more decision makers you can have in the room, the voices you hear from, we as the team that was really picking was more people involved in the actual evaluation was more IT focused, but then bringing the recommendations. We evaluated over 40 products, and those were the ones that passed muster that allowed us to evaluate that checked most of the boxes back then. But so you can imagine IT was doing more of that, and then bringing the recommendations of kind of the top handful to the teams and comparing and contrasting the list of features and things that each platform could provide. But
Good. So. Very good. Vishwa, who's typically coming to you like from a health system? What's the position of the individual who's either reaching out or the key person that you want to talk to first? I assume it's not IT to start with. It's not the CIO. It might be someone more in Jonathan's position, and then IT is probably quickly brought in if things are going to move forward. But tell me what you're seeing as far as who's approaching you, who are the key individuals, and then your thoughts on your advice for who needs to be involved as they work to, because you want to give them your best advice so they can make a good decision. I don't know if you ever provide advice on, hey, here are the people you may want to involve as you go making the selection process. It benefits you because it streamlines things. You probably want them to come with a solid decision rather than one where some key people were not involved and you say, okay, we know that this individual may balk, so it's not past the finish line yet. But your thoughts around that?
Yeah, so typically, if there are products that we generally are aware in the B2B scenario, right? HCM products, there is a clear owner and there is a person who comes, HR owns it, CRM, sales owns it. But when it comes to employee communication and collaboration, I think there are multiple people who actually need to own it for it to be effective and get the return on your investments. Who comes to us? CIO and I would say VP or EVP of corporate communications. Those two are still our two primary stakeholders. And they all, in most organizations, they are critical in the decision-making process. Once the product is sort of bought and people start using it to be most effective for everybody, there are some key roles and players that should be involved. If you have a dedicated internal communications team, that's going to play a key role in owning the strategy and operations of the communication. They would have a different success metric. Maybe it's employee engagement, readership, viewership. The IT team is also going to have an important role to play to get the full value out of the product. They're responsible for budget, infrastructure, and they're likely looking for improved clinician productivity as one of their success metric. HR team can be involved. They own the communication and collaboration around employees' journey in the organization. If you're doing a new employee onboarding journey and there's communication and engagement as part of this journey, they are going to play a key role. And that ties back to what you were talking earlier, Anthony, in terms of employee retention. And I'll extend employee retention to even employee advocacy. That's a metric that the HR team would own when they are using a product like MangoApps for communication and engagement. I would go one step further and say even the learning and development team, the L&D teams in organizations, they should be owning the communication and engagement around employee training. Healthcare organizations have compliance training and certification plays a very key role, and there's communication around that, and their success metric is likely 100% compliance. So I think there are these 4 or 5 key roles and players to get the maximum ROI out of the product, who should have a voice and ownership into it.
Vishwa, you mentioned the CIO is one of your key people coming to you and initiating this discussion. One of the interesting dynamics of a successful CIO that has been discussed over the years. Well, so one of the ideas is that IT shouldn't lead, they don't want to drive it. They want the business owners to drive it and they want to support. That's one way to look at it, and there's truth to that. And the other is that if you are a completely sort of passive CIO, meaning you're only responding to requests, that's not really what the business wants either. You need to be a combination of those two things. You need to be responding to the business, supporting the business, and getting the business to drive things. But you also need to be bringing solutions, IT solutions to the table to business problems that you know exist, even if you have not been tasked with that, right? So this is another way CIOs bring value and get that seat at the table that they're talking about. This seems like an area where they could do that, that they could suggest that, hey, I've heard there's been talk around here about some dissatisfaction in this area. There's solutions out there that may fit our problem. I don't know. What are your thoughts there around what you've seen? I mean, you've dealt with CIOs, you've seen ones that impressed you. Uh, is there any common denominator to the way they're approaching their job in light of that discussion or what I just laid out about simply being passive versus being active? What are your thoughts there?
Well, that's a great point again, Anthony. And I think the forward thinking CIOs play the role that you just articulated. They find that there's a objective or a priority in the organization to improve employee productivity or improve employee engagement, and they connect the dots by looking at solutions like MangoApps that help them achieve the other CXOs priorities, right? So they no longer are just a cost organization, but they are actually proactively involved in helping their peers at the C level to achieve their objectives and priorities. So those are where products like ours make a difference, and they change the status quo. Sometimes in organizations, that also helps establish a sense of urgency if the prioritization is right from the top in terms of the outcomes that are around employee experience, employee retention. And that helps the CIOs, especially the forward-looking CIOs, to be able to fast track improving employee communication and engagement related projects over, let's say, some of the other IT ops initiatives, which is, let me upgrade my HCM system or make a change to my ERP change process or tool. So they're making these decisions with a sense of connecting them with their organization's goals, and forward-looking CIOs do an excellent job at it. And our experience with a large percentage of them has been very, very good, I would say.
Yeah, well said. And I like the way you put that the good CIOs are looking to help address the other CXO's priorities. I think that's a really good way to look at it. All right. We're going to share our poll results here. 73% agree that email is an issue and sort of not quite making the grade anymore. 27% disagree, but that just shows you we have not rigged the poll. So otherwise, it would be one of those crooked elections with 100%. So certainly an issue there. Let's do with the Ask a Co-panelists. I'm interested to hear what you guys would like to know from each other. We do have a customer and vendor situation, but from our pre-discussion, you two have not talked that much personally before, so it's kind of getting to know each other a little bit. Vishwa, I'll let you go first. What would you like to ask Jonathan?
Well, Jonathan has been a great advocate in terms of giving us feedback through the channels that we have, even though we have not personally interacted with, but the perspective of user experience is important for us. So I would let Jonathan sort of maybe share a little bit about what does he see the next 12 to 24 months in terms of user experience improvements that help with employee communication and engagement. Sort of, if you wanted to put on a vision hat and share some of those thoughts.
Sure. Yeah. Thanks. One of the things we focus on is just a continual refinement of the platform in general. All the issues that get bubbled up or things that are too complex that might need to be simpler. We definitely pass all those along and get them in the list of things to make better. I think that's just, the nature of every platform is there needs to be a continual addressing of and improving of the product. And, I guess corporate world applications tend not to do a great job of that. If you look at corporate apps, they don't look like personal apps. They don't look like what people use in their personal life day to day. They're seemingly more antiquated or older looking, or and that in the user experience world, it's for sure a real thing that people get an impression of your product or your service within seconds of seeing it the first time. And if it looks old and people are going to think it's not well maintained and it's not going to work great, it's super important to continually, refresh a platform and to keep it looking like the new apps. Instagram and Facebook and all those other social apps, or TikTok, maybe even, like everything that people are using in their daily lives outside of work are driving design, and that's what they, people expect things to look a certain way. And when you don't do that on the internal company side, company software side, it's going to give the wrong impression. So that didn't answer your question yet, but that's table stakes, right? You just have to do that stuff. One of the things I'm excited about, maybe not really a user experience thing per se, but I think it could be, is this, AI stuff and chat GPT and the like. Super interesting. I think the ceiling is way high on these new technologies, on what those types of things could do for users. Maybe I don't even need to know where in the platform to go find something anymore. I just ask for it and it's hand delivered to me. Like that I think maybe in the next 12 to 24 months is something that becomes more commonplace and makes it further into these platforms. That would be super cool and helpful for users every day. Give me my latest pay stub, and it's just handed to you. Those things are powerful for users on the go and people who don't have time to spend digging for stuff, or they just want it now. Hand it to me and let me be on my way. So
very good feedback. Jonathan, did you have a question for Vishwa?
I can ask one. I think over our years on the platform, maybe something I've seen that you guys that seemingly do different, maybe or better than others, that maybe you can speak to how you make those decisions. Just how you decide what makes it into the next versions of the platform, where you're going to go from new features or new functionality or new things, and being able to couple where the industry is going in general with what your current client base want specifically, but then managing also where your vision for the platform is. How do you really balance what the next new things we're going to work on are to make sure that everybody's satisfied and get what they want?
Sure thing, Jonathan. I mean, I would say that as a rule of thumb in MangoApps, it's a 50-50. When we put out the roadmap for the year 2023, is for the first 6 months, we are consciously making a choice of taking 50% of the requests that are coming in what we have as the customer community. So MangoApps has this customer community where all our customers share ideas and vote on the ideas. One customer shares it, other customers are able to vote on that. So we take that as an input source, and 50% of what we are going to do in the first 6 months in the year is coming directly from that. Within that, we are triaging that, prioritizing that stuff, but that's 50%. We know what our resource pool is, we know the time, and we know what we can do in half of that time. So we know which ones to pick. The other 50% is largely looking forward. And you mentioned AI stuff. I would say AI would fall in that bucket. I would say 50% of what we would be doing is going to be in AI stuff moving forward. And that's primarily how the roadmap gets decided. That helps in some ways to keep the balance. It may be 48%, 52%, or 55, 45, but we make a conscious decision as management team in MangoApps to keep that forward. And I think that benefits our customers in two ways. One, we are listening to them and directly taking the feedback that they're giving us in the customer community and giving them back those capabilities, those use cases, those features in one way. And second, we are putting in the work of doing things that they likely they may want, but they haven't asked for. They would get to in 6 months, 12 months. So we want to make sure we are a little bit ahead of the curve here. And that's why the other 50% comes in and benefits our customers. And it's part of our long-term customer retention approach as well. This 50-50 model, and it's kind of has served as well if you look at our results and numbers around our customer retention and renewal rates.
Excellent. Sounds good. Sometimes, and that was the famous thing with the iPhone. Gave people what they didn't even know they wanted, and looks like we all wanted it. So it's good to have a balance there. We are about out of time. Wonderful discussion regarding continuing education. You could use the final slide in this deck. You'll receive an email when the on-demand recording of this event is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team. You can go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Jonathan Hensley and Vishwa Malhotra. And I want to thank MangoApps for sponsoring and making the event possible. And I want to thank you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you.